kinds of therapies have there been?
I see my clients once a week, and I give a lot of homework assignments. And being a behaviorist, I have a profound notion that what I'm able to do with a person in 1 week for an hour is nothing compared to what a person is going to be able to do for themselves in between the session. And see, this is why the behaviorist gave up in the 70s trying to work with puros. Because you say, well, what homework assignment can you give a puro? You can tell, I can get you to step on cracks 100 times a day, and that'd be great. But if your spike is to stab your brother, what homework assignment can I give you? Stab him? You know?
How about the kind of thing, though, that, like with stepping on cracks, if I was just walking around with you, I could step on every crack and not worry about it. Leave me by myself and forget about it on the basketball.
Well, you see, I would say to you that not worrying about it isn't the goal. I would get you to step on a crack and say, this means my mother's going to die of ovarian cancer. And I'd get you to step on another crack and say, now I'm going to die of a heart attack within the next week. And I'd step on another crack and say, God is going to condemn my grandmother to hell and burn forever. And so, to me, that would be the homework. I would want you to purposefully create the very thing that your brain uses to get you to escape. Do you understand that? Okay. And it's not so uncommon that clients in the office don't bring their problem and they leave it at the door and they can't explain why they don't experience anxiety with me, they don't spike with me. And I think that the idea is that there's safety, therefore they know they're going to beat it and the disorder doesn't show its face. That kind of gets into a global treatment issue, and that is that OCD, like all anxiety disorders, will beat you if you are not convinced about your capacity to withstand it. And when the anxiety threatens you, if you're going to be sitting on the fence about, am I going to do the ritual or not, it will hound you to death and it will last for hours. But anxiety that you're committed not to giving into only lasts 10 to 20 minutes. And that I've seen over and over and over again. And the people that I've worked with who have gotten better the quickest are those who turn to their anxiety and say, come and get me. And turn up the volume. You're making my stomach squeamish, you're making my head tight. I've seen this before, let's see how bad you can get now. Yes. And say to that bottom part of the brain, get worse on me, because I'm sticking you out. I'm going to really put up with you. And the people who have been brave enough to turn on their anxiety and really say that, whether it be panic attackers or OCD or agoraphobics, they get better very, very quickly. And because the panic attacker, that's the entire essence of their problem, my biggest problem with them is I only see them for 3 months. Whereas with a puro, it can take a year, before people really start getting, oh, spiking really isn't the problem. It's what I do about the spike. It's how I react to the spike. That's the problem. Yes?
What role should family members play when somebody carries out their obsession compulsion?
I never answer should questions. I never use that word. But I would recommend that if the person is committed to getting better, then the family can be a great asset in giving the person effective responses which in the middle of a panic might not come to mind, so freely. Like, take the risk. Go with the uncertainty. Live with this ambiguity. Yeah, I may die of cancer. I'm going to live with that anxiety. I'm going to live with that possibility. I want you to also. And I think that a family member who is savvy and committed to helping the person can stop being an enabler. And I think that's what most people's initial impulse is. Oh my God, this person's suffering. What can I do to shut it off? As opposed to, oh my God, this person's suffering. I'm going to help them suffer and not feel like they can't stand the suffering. And I'm going to help this person not engage in the escape response. So my answer to you would be different whether you're an OC or a pure O. A lot of times a pure O will say to the family, shut up, I'm just about to get it. Don't interrupt me. Turn off the TV. Don't ask me any questions. And a family member, not knowing, will come in and ask them a question, and then will flare out in tremendous rage. It's like you're building a card house, 1,000 cards, and someone walks in the room and sneezes on it. That's the experience of someone who's just about to solve the obsessive question, and then someone interrupts and they've got to restart the whole thing. And so I would tell people, don't legitimize that. Do put on the TV. Do ask questions. Don't alter your behavior as long as you're working with someone who's committed to getting better. And also, for people who look at this as the gradation, the hierarchy in behavior therapy, you start with, no, you don't start with the bottom of your shoes. You start with doorknobs, and then the bottom of your shoes, and then the toilet seats. And I've got someone now walking around with my saliva on a tissue, because he thinks my saliva is higher than toilet water, believe it or not. And I don't personalize any of this. Yes.
Would that work the same way with people who are compulsive buyers and savers and hoarders? Or is there a different type of...
Hoarders are definitely a subcategory of OCD, and it gets into such intricacies such as the idea that if I let go of this, maybe it will be important to me somewhere down the road, or this actually represents some meaningful part of me, that letting go will almost be like letting go of a significant part of me, or a friend gave it to me and letting go of this item is like trashing my friend. Hoarding gets into a whole different world and philosophy, and I've had a great deal of difficulty working with hoarders. But generally what I do is make home visits and torture them.
That's not a pure role, right?
No. It's an OC. Yes.
You said before that an accident without
I
therapy.
showed pictures.
I've seen pictures. Yes.
An accident without therapy causes relapse.
No, if you go on an Afrinil and don't have behavior therapy simultaneously, when you go off an Afrinil, you generally see the person going back to the old patterns.
How about the other way? Can you have therapy without an Afrinil?
Oh yeah, as a matter of fact, when I'm working with someone and they're not, on medication, what I say to them is, let's go 2 months before you go on medication. Because if you start getting better and you start medication while you're seeing me, how are we going to know what's doing it?
So it's possible.
Oh yeah, oh definitely. As a matter of fact, Margarita, who submitted an article along with mine to the OCD newsletter, she did it all without medication. She had been a Puro for 20 years. I've seen more improvement in quicker fashion with those who haven't been on medication. One thing that I see about people on Prozac is that they say things like, okay, I'm feeling better, now you want me to rock the boat? I've got elbow room for the first time in 15 years, and you want me to every hour touch this rag that's been in toilet water? What are you kidding me? And yes, exactly, and then become incredibly fearful of going off the medication because they think the medication has been everything, and they haven't had any input. So I've got a lot of concern about people who go on medication, and I'm always wrestling with them to start to go off, to really test out how much have they integrated into their system.
Stephen, I'd just like to say, when you do behavioral therapy, it's important who you see. That's because a lot of people present themselves as behavioralists that might not be.
Yes. You're not seeing a behaviorist unless you get homework assignments.
Did you see that article this week on Prozac?
Yes.
Yeah, what did you think of it, where some people actually killed people and they said the Prozac made them do it?
That's just, I don't believe that. I've been on Prozac for over 2 years, and I've never...
That's what I heard in this group, but I was wondering what you thought of that. Do you think it could have been?
I really can't comment on that. I'm not a specialist with Prozac.
Yeah.
Anyway, so... Yes?
What to expect with hoarders? Is it medication or
Hoarders are a real special subcategory within the obsessive-compulsive realm.
I have a son.
Generally, Well, first of all, let's distinguish between what I refer to as ego-dystonic obsessive compulsive disorder and ego-syntonic, and other people refer to as overvalued ideation.